Welcome back. Dr. Sharon Natanson, advanced heart failure and transplant specialist from the University of Florida, joins us to talk about heart health. Thank you, sir. I really do appreciate you being here, doctor.
Thank you, David, and good morning.
Good morning. All right, so tell us about heart failure.
So if you want to stick with the definition of heart failure, it's the inability of the heart to supply the body's demands.
Okay.
Now, the heart is like a pump, the most efficient pump that you will ever see. The size of the heart is like a fist. Do a fist, David. Yeah. So this is the size of your heart.
Okay.
Now it does two things. It needs to contract, but it also needs to relax in order to get the blood from the body and then push it forward to the other organs of the body.
Gotcha.
So we have two types of populations that we see with heart failure. The first one is actually the one which have reduced contractility, reduced squeezing of the heart.
Okay.
Instead of the heart doing something like this, it's doing something like that.
Okay, understood.
The second population that we see is the one that the heart cannot actually relax. The heart is stiff, exactly.
And then it
this
just
is your
won't.
fist, and then when it needs to relax, it cannot really relax.
Gotcha.
So this is the second part of the second subtype of population that we see. The symptoms, by the way, are pretty much the same if you have reduced contractility or if you reduced relaxation. You cannot identify which kind of population you deal with until you
Just based on the symptoms.
Exactly.
So what are some of the symptoms?
So the heart failure symptoms are not very much specific. For example, fatigue or tiredness. I'm tired, you're tired, I understand you woke up early, so we are all tired. But it doesn't mean that you have heart failure. But when symptoms starting to accumulate and you have leg swelling and you have shortness of breath, people are coming to the clinic and then they tell us we're starting to work in the house, we're starting to mopping or cleaning, and then we get short of breath. People try to lie down flat at night, but they can't because of this shortness of breath. People wake up at night gasping for air. There are other GI symptoms, gastrointestinal symptoms, for example, more in young patients where they have early satiety. They try to eat and they fill up quickly. They cannot eat.
Interesting.
Nausea, vomiting, all of these symptoms, when they are accumulated together, and I urge the audience that if you have these symptoms, go to your PCP and try to find out exactly what's going on.
Absolutely, it could be very dangerous. Okay, so what kind of medications are used to treat heart failure?
So first of all of the medications that we do are wonderful. And this is why all heart failure patients, we urge them to be very much compliant with the medication. We have 4 basic medications that you want to take when you have heart failure, but I'm not going to name them now, but patient needs to know that it is a lifetime process, a lifetime compliant with the medication. The most maybe important part for the patient, at least at the beginning where they start to accumulate all the fluids, they have this leg edema, leg swelling, shortness of breath, we give them what we call a water pill. Because of the heart failure, the body started to retain fluids. This is why they get short of breath. This is why they can't lay flat. We give them a water pill, whether it's Lasix or Bumex. People with heart failure know what I'm talking about, so they can get rid of the fluid. And if they cannot get rid of the fluids with pills, we actually admit them to the hospital, and we're going to give them this water pill, but through the IV, which is more aggressive and gives more rapid results. But this is like the main treatment. Now, what happens if we do not manage the patients with medications? This is when we start to consider what we call advanced therapies of heart failure, meaning heart transplantation, replacing the sick heart with a new heart. And the average survival now is about 14 years, meaning figure for yourself that a patient who were on the verge of dying and now gets 14 years to live, which is amazing.
That is amazing.
The other thing that we can do is replace it with a pump. Like the old heart or the sick heart stays in place, and we connect it to a pump. This is the 2 types of things we can do when we consider advanced therapies.
That is impressive. All right, so tell us about the state-of-the-art heart failure clinic.
So now in the UF Jacksonville, we actually figured out this heart failure is really a pandemic. 6.7 million Americans live with heart failure. And within 10 years, in 20 within 5 years, within 2030, we expect it to be 8.7 million Americans with heart failure. This is really a pandemic. So the University of Florida in Jacksonville actually took some action against it. So what we do, they're going to give us a lot of sources now. We're going to expand the clinic. It's not only me, it's my 2 nurse practitioners as well, Brenda and Jana. We are working all together. We discuss the cases. We're going to give us more manpower in order to reach out and to do remote monitoring. And if something the COVID taught us is actually we can do remote monitoring and treat the patient before they come to the hospital.
Right.
So our main objective is to keep the patient out of the hospital. This is the main objective. It's a huge emotional burden on the patient and the family.
Absolutely.
With the drugs that we give, we can actually prolong life, have a better quality of life. But I'm glad to see that glad to be in the University of Florida. I'm pretty new there. I just started two and a half months ago. But looks like all the resources are going towards this direction, and I'm glad to be here.
Doctor, you're an amazing man.
Thank you very much, David.
That is
it was
fantastic.
a pleasure.
Wow,
Thank
you are truly, that's amazing work. Guys, we'll be right back.